Dr. Srivastav, I have a different perspective. This question is from the other end. The students that you have treated, ऐसा क्या है medications के अलावा जो उनके लिए चल गया है, जो हमें लगता है आज के students को बताए before they get जो भी मानसिक तनाव या जो भी हो जाए, ऐसी क्या चीज़ें हैं जो आपने यूज़ की है ट्रीटमेंट में, जो अभी यूज़ कर लेते हैं, डेली लाइफ में डाल देते हैं ताकि ये कभी ना हो?
ये सवाल तो बड़ा अच्छा है, मगर बच्चों को इस पे जो कुछ मैं कहने जा रहा हूँ ध्यान से सुनना चाहिए और उसे अमल में लाना चाहिए। देखिए, द पर्पज़ ऑफ मेडिकेशन इज़ वेरी डिफरेंट। मेडिकेशन डज नॉट क्योर any like, do diabetes medication treat diabetes? No. Do hypertension medication? They control, they keep it in check, and there is hardly any medication except for infection and other kinds of communicable diseases that we know that medication can treat them once for all. But the diseases of mind and brain and body, what you call psychosomatic illnesses, are a primary psychiatric disorder, whether it's depression, schizophrenia, addiction, etc. Medication has a role, but the improvement is up to about 50, 60, 75%, not more than that. And if they stop medication, the relapse rate is also very high. It varies between 50 to 80% in 3 to 4 years period. There are some illnesses which have time bound. Say you develop a little bit of psychotic breakdown, you treat and you take medication for 2 years and you are fine, medication can be stopped. But the risk of relapse always remain. One has to. So what can be done so that anybody's life who has undergone a psychiatric disorder remains good, quality of life remains good, and what can be done so that someone does not develop a psychiatric disorder? Two are different questions, but there are commonalities in the methodology that is employed. So for example, there are two kinds of students, one who are vulnerable and one who are not. So who is vulnerable for mental health condition? First, those who have a family history where their parents or parents, grandparents, etc. have suffered a kind of mental disorder, they are highly vulnerable. Or those where mothers have suffered a lot, a stressful factor when she was pregnant or when the child was born immediately. That is another risk factor. The third risk factor is the quality of parenting that the person has received. The fourth risk factor is substance abuse. The habit of alcohol and drugs, and these conditions, these situations, they precipitate a mental disorder far more easily. Then comes the head trauma or neurological diseases like epilepsy, which is very common in small children. They develop convulsions like this, and or somebody who has developed encephalitis or any other brain fever. So anything which affects the brain in childhood, the person remains vulnerable for developing mental disorder. That's one group of. And when the students come to school, nobody knows about the history. There is no system to isolate and recognize who is vulnerable, who is not. Those who are vulnerable, they definitely need better monitoring and better support. Now, those who are not vulnerable, they also are susceptible to develop a mental disorder by virtue of environmental stress. Stress, see, all mental disorders are preceded by stressful factors. And a lot of people who are subjected to chronic stress develop psychiatric disorder. So the stress factors is a common pathway which works in precipitating a psychological disorder. The difference is that if someone is not genetically vulnerable, the severity of and complexity of the disorder will be far more easy to handle. So the first thing that children and students must know how to handle stress. Now, the question comes, do they recognize what is stress? Do they recognize what is the nature of stress? Where does it come from? For example, somebody loses sleep, and for months together somebody is not able to sleep. You think that students go and disclose it somewhere, or do they talk about it? Or there is problem of concentration, that it is the same school, same college, same teachers, same friends, but he goes and he says, I cannot focus, I cannot do maths, my productivity is not same as it was. You think anybody pays attention to unless the parents are highly vigilant? So these we call psychological symptoms, not diseases. Psychological symptoms like sleep, appetite, concentration, memory, mood changes, social relation, anger, anxiety, hopelessness, loneliness, all these we call soft signs, they start appearing. They are the physical signs of stress. Gradually it increases and the person starts living under influence of high cortisol, because we know that stress is closely related to high cortisol.
Cortisone matlab?
Cortisol, it's a kind of chemical substance which is secreted in the body, and it is in response to how stress affects our body. The vehicle for damage is the cortisol.
Okay.
And that changes the character of brain cells. So your response for lifetime changes if you have lived under chronic stress, and that makes you vulnerable. There's a lot of research on brain effect of stress and how people become vulnerable. So the need is that we recognize presence of stress as early as possible. After you recognize, the need is that you deal with it. For example, if a student is not liking the course and he's under stress and not speaking, if you don't deal with it, it will become chronic and you'll suffer. The answer to it is you talk about it, and if you don't like, you always join the subject that you like. But the reality of education, employment, social situation in our country and most of the places is so harsh that students do not have much option to opt according to their interest. They are more dependent upon their aptitude, that your aptitude is to become doctor. Now, when you say that your aptitude is to become doctor, that aptitude test does not test my ethics, my morality, my involvement in research and my character to deal with human being. What it tests is a kind of what will I study cognitively and how will I deal with my subject matter. You say that this person has aptitude to become engineer, that means how well you will deal with the content of academic content of the course, you have that aptitude. It does not test the larger objective of a person. So the stress management or managing stress is the second most important. The third is ability to resolve conflict. Most often, over and above the presence of stress, students suffer from conflicting situation. They are unable to take a decision. Should I join sports? Should I not? Should I do exercise? Should I not? Should I study? How do I divide my time? How do I do it? I don't like this person, or there is fight with some other friend. It's going on and they live in the conflict. The conflict manifests in social behavior. They stop coming to the classes. They stop doing their homework. They stop sleeping well. Their nourishment goes down, and the conflict changes into chronic stress. Again, they become vulnerable to develop mental disorder. The fourth important thing is their ability to accept themselves as they are. For example, if some boy is obese and he feels shy, it is important that he is given a kind of counseling to accept things as you are, because your self-esteem will grow only when you accept yourself